Hello, I am Shanna Wolverton, and I will be doing a head-to-toe assessment today. And I have washed my hands, and I have pulled my curtain, and explained that I'll be doing a head-to-toe assessment to my patient today. And can you tell me your name and your date of birth, please?
My name is Lucille Ball, and my date of birth is 5/21 of 1985.
Great, thank you. And so we will start with the face, and what I will be doing is checking for any blemishes and moles, any abnormalities. No blemishes noted, no dryness or anything like that noted. Okay, and so now I will move on to the cranium and the scalp and check for any abnormalities there. Put on my gloves, and I'm just going to feel and palpate, inspect, okay, and no redness, no dryness of the scalp, the hair, I'll note the color, blonde hair, and the growth is throughout, it's fine. The growth is good throughout. There's no bald patches or any spots or anything like that to note. And no nodules or anything on the cranium. Do you have any tenderness or pain?
No.
Okay. All right. You can raise your head there. All right. And now, if you will, can you smile for me? Okay. And right now I'm noticing the symmetry, and both sides are symmetrical, no problems noted there, and the expression, no flat affect or anything like that. So her expression and her symmetry are good. So now I will palpate the temporal arteries, and no bounding or anything like that noted. Okay, and now I will evaluate cranial nerve 5. I'm going to ask you to clench your teeth.
Okay.
Okay, can you blow your cheeks up with air? Good. And can you, I'm going to also, I'm going to check with a cotton swab. I'm going to go down the side of your face and just check for, okay. Good. Good. All right. And now we are going to check your jaws, the temporomandibular joints here at the jaw. And what I'm going to ask you to do, if you will open and close your mouth. Okay. And again, good. No clicking. Was there any pain noted? And that's the TMJ joints, and all was well. Okay. Now, can you also close your eyes tightly? Good. All right, and raise your eyebrows up and down. Good, good. And both are symmetrical there as well. Okay, so that's for the eyes. We will also now do the visual Snellen test, and what that checks is 10 feet away. Do you have contact lens?
I do.
Okay, and you will wear those as we perform this, and I've got you marked off 10 feet away there. And if you can, I'm going to hand you this card, and if you will just cover your left eye and read to me the lowest line that you can possibly read with that eye.
Okay. I'm line number 9, VEMYATTEN.
Okay, good. And do the other side, please.
That would be line 10, TIONTHINGS.
Good, very good. Okay, and that completes the Snellen test. And you can come back to the table, please. All right, and now we will check the extraocular movements, and if you will, just follow this object as I go to the 6 fields of vision. Okay, so what you will do is keep your head still and just follow my object with your eyes, okay? Good, very good. And her eyes moved according to the object, and no problems noted there. Okay, so now we will test her pupils, and for size, equality, regularity, and response to the light. So I have my pen light, so I'll check that there. Okay. Good. Okay, and I'm going to check the conjunctiva there. Okay, and they're pink. The sclera is white. Her eyes are blue, and I'm not noticing any problems there with her eyes. The eyebrows and the eyelashes, there's no patchy, no missing eyelashes or eyebrows or anything like that noted. So all of that checked out well. So what I will do now is check for the accommodation to light. Okay, and that all reacted well. So no problems there with her pupils or anything with her eyes. Okay, so the eyelashes, the eyebrows, all of that they're evenly distributed as well. Okay, so now we will we're finished with the eyes. We've noted that the conjunctiva is pink, the sclera is white, the corneas, the irids are all symmetrical. Everything is good with the accommodation to light as well. So now we will move to the ear, and what I will do is just assess the outer aspects of her ear and noticing if there's any pain. Do you have any pain with your ears? Okay, and I don't see any drainage. Palpating the ears and inspecting, okay, and not noticing any drainage there. Both are symmetrical, no problems with the ears. Okay, now I will test her hearing by doing the hearing test at arm's length. What I will do is occlude one ear, and I will whisper a word, and she will repeat to me what I say. Okay, so
Blue.
okay, good. And now this other side.
Blue.
Good. All right, and so both, she said the same thing, and that's what I said, and she repeated it back to me. So now we will move to the nose, and what we will do there is I'm just going to check for the septum. There's no deviation noted. There's no nodules noted of her nose. I'm just going to check now and just see if there's any drainage. No drainage noted. And if you will, for me, occlude one side of your nostril. All right, sniff. And then this is the sniff test, and she will do it with the other side. Sniff. Good. Good. And no problems noted there. The patency of the nostrils are good as she sniffs. Now I will check the maxillary and the frontal sinuses. So I will palpate here. Okay, any pain?
No.
Good. All right, and no problems noted there. Now we will move on to the mouth and the throat. And so I will put on my gloves again. And I'm going to ask you to open your mouth. Okay, so what I am assessing is her palate, her teeth, her tongue, her gum line is pink. There's no problems there. Her teeth are all in line. Can you open wide again? The uvula, there's no drainage in the throat. She does have her tonsils and they are not enlarged. The buccal mucosa, she does have moist membranes. And now I will check for the gag reflex, okay? And what we will do is I will place this on your tongue and you say ah, please. Say ah. Good. And she lifts her, when she does that, she lifts her, the uvula does rise and fall, and it reacts. So now, if you will, stick out your tongue for me, okay, and can you move it to the left and to the right, all right, and there's no problems there, it's all symmetrical, and all as well with the tongue and the mouth, the nose and the throat. So now we will move to the neck. And what I will do is check the lymph nodes of the neck. Okay, so I will palpate, and we will start with the preauricular, the postauricular, the occipital, the submental, the submandibular, the tonsillar, the superficial cervical, the posterior cervical, and the deep cervical chain, the supraclavicular right here above her clavicle. And I don't notice any hard nodules or anything like that. They're all spongy, no problems noted. And now we will have you to test your range of motion of your neck. So if you will, just lower your chin to your chest and tilt your head back. And from each side to side, move your head from side to side, twist it side to side. Okay, and now if you will, have your ear to your shoulder on this side, shoulder, and now the same. And no problems noted there. It's all symmetrical movement. Any pain noted at when you're doing those things? Okay. And now I'm going to ask if you will shrug your shoulders against resistance there. I'm holding down, and she does that symmetrically all as well. Okay, and so now what I will do, I will have her to drink a sip of water, and when she does that, I will be behind her, and I'm going to assess, as she takes a sip of this water, I will assess her trachea movement, okay? Okay, and the swallowing, the reflex is good, and no problems noted there with the trachea. So the trachea is in a line. Now I will check the thyroid here, and I'm not noticing any problems there with the thyroid. No hard nodules, no enlargement or anything like that. Are you having any pain there? Okay, and so now what we will do is check for carotid bruit. So what I will do is first I'm going to palpate and inspect there. We'll do one side at a time, being careful not to occlude. Good. And good. And now I will listen here. Good. And there's no swishing or shrill sounds or anything like that to indicate any bruit or anything. So the carotids are good. Now I'm going to ask, if you will, to move to the back of the table. If you will, just shift around to the back of the table. And what we will do is assess your chest, posterior chest wall. And what I'm doing now is inspecting. I'm not seeing anything, a slight freckling, no large moles or any lesions or anything like that, no sores. And what I'll do is just go ahead and check the lower chest there, the back posterior, nothing noted there. So inspecting, nothing found on inspection that indicates any abnormalities. And now I will palpate for tactile phrenitis, and what I will have her to do is repeat after me as I say 99. And each time I ask you to repeat, please repeat after me. 99.
99.
99.
99.
Okay, I'm going to hold my hands underneath here. 99.
99.
And 99.
99.
Okay, and the vibrations were symmetrical, no problems noted there, and the chest would rise and fall symmetrically there, no problems noted. Okay, so now we will do the flank, and I will just tap right here on like it's over her kidneys, and we will just test here. What I'll do is use the side of my hand. Okay, are you noticing any pain?
None.
Any pain there?
No.
Okay. And that's very well too. So now I will check her breath sounds by auscultation and go over the 9 fields there. Okay? 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 Going underneath the shirt here. Good. Okay, all nine lung fields are within normal limits. No crackles, no rails, no rhonchi, no wheezing, nothing abnormally noted there. And her chest, the posterior chest wall does rise and fall symmetrically. So now what I will ask you to do is turn to the front side again, please. Okay, and what we will do now is I will assess her arms and palpate, inspect, not seeing anything abnormal, no large moles or anything to worry about there. They're symmetrical, the skin coloration is good, just slight freckling again. And so now I will, there's no swelling noted either on palpation on her arms. So now I will check her radial, brachial, and ulnar pulses. So we'll do both sides. The brachial. Good. The radial and the ulnar. And again, the radial and the ulnar on the right side. Good. And they're all symmetrically, they're in rhythm, good pulse, not too strong, not bounding or anything like that. So now we will assess the capillary refill. So test this, just pressing on her nails. And they're all less than 2 seconds on the refill, and that's what we want. Good. Okay. All right. And now I will test the range of motion of your shoulders. If you will, raise your arms up. Okay. And now hyperextend them back behind your back, please. Okay. And now abduct. Okay. And adduct. Good. Symmetrical movement again. Good muscle strength there. And then, if you will, shrug your shoulders against resistance. Good. Good. Good muscle strength, good range of motion there. And now, if you will, hold out your arms and pronate, good. And now supinate, rolling over, and then back again, pronate, supinate. Can you bend your elbows, flex, okay? And can do it again, please. And we're going to do it against resistance, pull, extend out. Okay, now pull your arms back, good. Good muscle strength and noted there. And so now, if you will, I'm going to have you to test the range of motion of your wrist. And if you will, hold your arms out and flex up and then down and then roll your wrist. Okay. And if you will, have your fingers spread out. Okay. And clench a fist. Good. And now, if you will, have your fingers touch to your thumb, each one. Good. No problems noted there. They're all symmetrical. Good movement and good flexion with her arms. Nothing noted there. So now what we will do is test the cerebellar function by having her to touch her finger to her nose and then back again. So if you will do that, hold your arm out, touch your, good, again, good. Good. And so no abnormal cerebellar function noted there. Okay. So now what we will do, let me do the, if you will, try to pull your hands up against resistance to flex your wrist. Okay. Pull them up. Okay. Good. And now push down and flex your wrist. Good. Good. No problems noted there. So now we will do serogonous and we will do the graphesthesia test. And with the graphesthesia, I'm going to write a letter with my finger in in the palm of her hands, and she's going to call out back to me what I've drawn in her hand. So on your right hand,
J.
good. All right. And now your left hand,
S.
good. Perfect. And she did call out what I drew in her hand. Now for the astragalus, I'm going to place two separate objects in her hand. In the left hand, well, the right hand here, I'm going to place an object. Please close your hand and tell me what I've placed in your hand.
Paperclip.
Good. Very good. And then her left hand, please feel and see what I've put in your hand there.
A penny. A coin.
Yes, a coin. Yes, a penny. And both objects were correctly identified. So now we will rate the triceps, biceps, and brachial reflexes. So let me get my reflex hammer here, and I'm going to hold your arm out to the side, and I'm just going to tap lightly here and check her brachial reflex. Good. All right. And now, I'm sorry, that was the, this is the brachial reflex here. The triceps and biceps were back here. So this is the brachial. Okay. And now the radial. Good. All right. And again, we're just going to relax, okay? Good. The brachial, I'm gonna hold it out, just relax your hand in mine, okay? And then the radial. Good. All right, and no problems noted there. So now we will move to the anterior chest, and I'm just gonna ask you to lie down, please. And so what I'm going to do is first inspect the chest wall, and I do notice that there are freckling again noted on her chest wall. I'm just going to watch her breathe. There's symmetrical going up and down on both sides, no problems noted there, and there are no nodules noted on her chest. Okay, so the work of her breathing is not labored. There's no problems there. So we will palpate the precordium. This is the point of maximum impulse, and see underneath here. Okay, with the palm of my hand here. Okay, and no problems noted there. With the pulsations, no heaves or thrills noted. Now I will auscultate her heart sounds, and we will go through the aortic, the pulmonic, and the mitral, and the tricuspid valves. This is the first of all, we'll move to the aortic here. Okay. The pulmonic. The tricuspid here. And the mitral. Okay. And there's no abnormalities noted, no second heartbeats. There's a first S1 and an S2. There's no gallops, rubs, or anything like that. And the heart sounds are good, and nothing abnormally noted there. Now my stethoscope does flex, and it does both sounds for the bell and the other side. So I will just twist it and listen with the bell sounds for each one of these. And now I'm listening for any bruise or any other swishing sounds or anything. Okay. And that was the aortic and the pulmonic. Now the tricuspid again, and the mitral. Okay, and no problems noted there. So while she is lying down, we're going to move on to the abdomen. And what I will do is inspect and auscultate the abdomen. So what I'm noticing is freckling again. She does have some slight scarring, but nothing abnormally noted to her abdomen. So the skin is all intact, no sores or wounds or anything like that noted. The contour, the symmetry, no visible pulsations or anything, or paralysis. I just see her, with her breathing motions going up and down. So, and now we will inspect around her umbilicus area. There's no hernia or anything like that. Nothing abnormal noted there. And now I will auscultate the bowel sounds in all 4 quadrants. Now flip it back so I can hear. Good. Good. And her bowel sounds are normal and active, and not hyper or hypoactive. So they're all good. And now what I will do is auscultate the renal arteries on both left and right side. Okay, so it's on the left side here. Okay, and no bruise or anything like that noted. No swishing or abnormal sounds. Just okay. Both sounds were very good. Okay, so now what I will do is percuss all 4 of the quadrants, and what I'm noting is the organs and the hollow, the bowels and the stomach will be resonant there. 4 areas. Okay, and that's all good. There, it was resonant. And then over the liver, which is a solid organ, will be dull, not resonant. And so that is, the liver is located here right under that right rib there. So now after the percussion, we will do the palpation, and what I will start with is the light palpation. Just tell me if there's any tenderness or anything noted in any of these quadrants, the top right and top left, and then bottom left and bottom right quadrants. And I don't feel anything abnormal. And palpating, deep palpation. We'll do the deep palpation for the liver, which is located again here under this right rib. Not noticing any, nothing hard, no nodules or anything, no swelling or anything like that noted to her liver. Nothing abnormal to note there. So, with that, we'll also, while she's lying down, I will have inspect her lower extremities, and we'll lower your shirt there. Thank you. And with her legs here, they're both symmetrical. There's the skin. I'm inspecting the skin. There's no scarring, no moles or anything like that to note. All this looks fine. So with inspection is fine. So palpating her lower extremities, I'm not noticing any pretibial edema and no edema in her feet or ankles at all. Okay, and now I will check her pulses, and so the dorsalis pedis pulse. Okay, and the posterior tibial. Okay, and then the popliteal. Okay, and then the other side. Okay, good. And pulses are not bounding, or and pulses are good in all of those locations. There's no swelling noted, no edema or anything like that. So now I will ask for you to, can you roll your knees out to the side? Just roll this knee out and then roll this knee out. Okay, roll them back inward. Good. Okay, so now I'm going to check your strength and motion in your ankles. So if you will, lift your toes up towards you. Good. And then downward. Okay, now flex them back with resistance. Checking the strength here. Go ahead and pull back. Good, good. And then now push down. Good, good. Very good. So now, if you will, lift your left leg up at a 90-degree angle. Okay, all right. And then your right leg up at a 90-degree angle. Okay, and then now pull your knee to your chest. Okay, good. And then again with the other side. Are you noticing any pain or anything as you do any of that? Good. All right, so good range of motion, inward and outward rotating the knees, and lifting the legs at the 90-degree and pulling back to her chest. She had no problems with that. And the strength of her ankles were good. So now what I will do while she's still lying down is we will check the Babinski reflex by swiping the cotton tip down the side of her foot. Okay. Okay. All right. And there was some twitching of her toes a little bit there, and then bending of her toes down, but not spreading out, because if she would have spread out her toes, that would show some type of neurodefect, and there was none noted there. Sorry, I tickled your toes. So we finished that with the Babinski. So now, if you will, I'm going to also check the patellar and the Achilles reflexes by using the reflex hammer. So if you will, have a seat here on the front again. Okay, and now we will do the patellar reflex. Okay, I'm just going to tap lightly. Good. Tap lightly. Good. All right, and the Achilles. Good. Good. Okay, so the reflexes are good. They're not hyperactive or anything like that. And now we will also do this test for the cerebellar function as well. If you will, have your right heel and rub down the front of your shin. Good. Okay, and then do the same to the other side. Good. Okay, no problems noted there as well. So now we will assess your lower extremities. Just doing a little walk test for me. if you will, stand here, and then I'm going to have you to walk, turn toward this way, yes, and then walk on your heels just a short distance there. Good. Now walk back on your toes for me. Good. Okay, and no problems noted there. So while you're still standing, I'm going to ask if you will stand on one foot and hop. Good, and testing the strength there, good. And then the other side, please. Good. All right, any problems there? Okay, and now if you will turn toward this way, I'm going to have you bend over at the waist. Okay, and if you will, are you having any problems there? Any pain? I'm checking your spine here, and it all looks good and in line, and nothing, no problems there. And just go down as far as you can to your toes. Good. And still, again, no curvatures or any problems with the spine noted there. So now, while you're still standing, if you will, I'm going to have you to perform the Romberg test. And what the Romberg test is you just have your eyes closed, and I will note her stance. Okay? No swaying or off balance or anything like that. You can open your eyes. No problems noted there. So, if you will, now I'm going to have you to stand and bend to the side, okay? And then to the other side, and then bend backwards. Good, good range of motion there, and no problems with that. And can you twist from side to side with your shoulders? Okay, good, good. And no problems there. Are you having any pain? Good. All right. That completes our physical assessment today. Thank you so much for being my patient.